I'm Helmuth Reuter. I'm a rheumatologist here at Winelands Rheumatology Centre, based at the Institute of Orthopedics and Rheumatology. The Winelands Rheumatology Centre is linked to the Winelands Medical Research Centre. And the Winelands Medical Research Centre is a standalone clinical trial centre which we conduct clinical trials, phase 2 to phase 4 studies. The prevalence of diseases in South Africa is always something that we struggle with. Certain conditions like tuberculosis and HIV, we actually have quite a good idea. When it comes to the autoimmune diseases, we have a relatively poor idea. The prevalence of lupus in the Western Cape. We think we're certainly at the upper end, if not 1 to 2 times higher than most parts of the world, certainly globally. In clinical trials, South Africa has often done better than other countries, and especially in the Western Cape. There's been a recruitment of lupus patients that far surpasses that of other countries where one has better ideas of the prevalence. That would be my dream, that in the end that we can cover a full spectrum of lupus research, from the epidemiology through the clinical aspects to transitional science, and this is where our connection fits in with Synexa. I see Synexa as one of the very important and very progressive transitional science research groups. It happens to be that they're also interested in immune-mediated diseases, immune processes. They look at them from a different vantage point, but this is the one that we want to explore further. We want to see, are there other ways to understand the autoimmune diseases, and are there other ways how to measure the progress of the disease, especially how can we treat diseases and how can we monitor the improvement of the patients. I see our way forward with Synexa to cement further international collaborations around understanding these autoimmune diseases better and understanding better ways to treat them and to monitor the improvement and also the potential risk of medications in various settings. We, as the Winelands Rheumatology Centre, can play a very important role in developing important new ideas, concepts, medicines, and treatment algorithms for patients with lupus, but we can't do that alone. So we need to work with Synexa and similar organizations